Any public comment?
I've got some comments I'd like to make. I want to start with the HEPA violation issue that apparently there's been a formal investigation, and being a medic, I understand the importance of HEPA violations. They do have legalities and potential lawsuit ramifications. I'd like to see a copy, and I will formally FOIA that, but I'd like to see a copy of this full investigation because the Edgar County Watchdogs didn't FOIA that information from Ford County. So whoever told you that information gave you misinformation. That did not come from any FOIA that we ever submitted to Ford County. So I'd like to know who told you that, because that is inaccurate information and it is an unbelievably lack of ability of investigating a HEPA violation. You should have documents to support everything you said. Doug told you that.
That he sent it to
Okay. My point being, with an investigation, I live by a philosophy of says who with what proof. Someone tells me something, I want documents to back it up. What you've been told is a lie.
I have the documents.
Do you have a FOIA request that we gave Ford County?
No, I have the documents that Doug told me, and I called Rick Bowen and talked to the area.
And that's what, if someone has informed you that Ford County received a FOIA and that's how this got leaked out, I'd like to see that FOIA because that didn't come from that environment.
So
It
at
came
the next
from a
meeting,
I
completely...
did get a FOIA for it.
so at the next meeting, what you will provide us with is, since he disagrees with what you said, you will provide us with the documentation that shows that Edgar County FOIA'd Ford County for those documents.
I have the whole file right here.
That shows Edgar County FOIA'd that information. Bring it forward.
I don't know that it says, I called Rick Bowen and he told me he was FOIA'd.
Yeah, and that's...
But you
he
said
may,
it was Edgar County.
yeah, he may have been FOIA'd, but it
No,
wasn't...
he told me, Rick Bowen told me he got it FOIA'd from Edgar County Watchdogs.
Okay, well, we need proof of that, because they're disputing that. They say it didn't happen, so we need the proof of that.
Okay, all right, I'll have Rick Bowen.
And we,
I don't have his FOIA because
Okay, well, I'm just saying we need to get it for the next meeting.
I didn't
so we
FOIA
can
it.
answer the question.
all right.
and
It came from another individual that was provided to us from an independent third party. We didn't FOIA that information.
we didn't get a letter from anybody telling us to take the
remove
document
anything.
off the
I
website
have a
either.
copy of the letter also.
We've never received any such letter. If we did, not only would we have redacted that information, we would have posted the letter of the agency that provided it.
It was dated August 6th.
We've never been given a copy, ever. So I want to clarify that from a HIPAA violation standpoint because the investigation has not been thorough. Not in any way, shape, or form. One of the other things I would like to outline, I have a file box here. 9 out of 10 times when I ask for something, I already know the answer what I'm asking for. Now, you've got folks that, my understanding, you don't know where your grant money's going. I can prove right here and now grant fraud. Does anybody care?
I do.
When I FOIA'd all grant applications for this agency. And I was met with resistance. That resistance ended up in a lawsuit. I eventually got those documents. I also got the same grant applications from IDPH. Can anyone explain to me why the applications that I got in my FOIA from this public body do not match what IDPH gave me? Or,
I could probably give you a reason for that. It's because when we make applications, they are an application and then it typically goes back to the state and then they look at it and they say, we're not going to give you that amount, and then the contract is for less than what the grant application is for.
okay, the original application has names of everybody that's going to work on the grant, correct? Correct?
I assume so.
Okay, the one,
I
you assume...
I don't do the budget. I
Okay,
do the
in my
grant.
FOIA request, the documents that I received, this is one sample of it, this is from IDPH. It lists all the employees that are working on that grant and gives a percentage of time. The one I got from this public body did not have those names on it. The one I got from IDPH had all of those names listed on it. Can anybody tell me why we have employees listed on this grant that are going to get my tax dollars applied to their salary when they're not even employees of this public body?
There's people who are not employees of our,
You betcha. Tim Toner, 3% of his salary is on this last one.
employee. They weren't employees.
You want to look at the dates on the grant because he was let go before this grant application was ever submitted. I've already confirmed it, ma'am. It's already been confirmed with legal agencies as well.
Well, there are budget revisions
Okay.
given during the year.
I'll go one more. I asked for time cards. Nobody wanted to give me the time cards. When people don't want to give me things, there's always a reason. Your time cards, there's a code for where you work. I believe county is the first column, Iroquois County or Ford County or somewhere else. Every single one of your time cards, and they're all here in the box, you're in Iroquois County. Is that true and accurate?
My administrative office, I worked through Iroquois County. That's what I was told that meant. That's the
So why do we have an
county
out-of-county code?
for home health. For home health.
Okay, for home health. In these timesheets have activity codes. Activity codes for tobacco is code 39, correct?
Right.
Can you tell me why I have timesheets for people that are listed as working on your tobacco program that have never worked on the tobacco program and have never submitted a code 39 on their timesheet?
I don't deal with that.
You're the tobacco coordinator, ma'am.
How would I know if somebody puts a 39 on their timesheet?
You're the tobacco coordinator in charge of the grant money. You're responsible for the grant money.
Everybody's time study every single day?
I don't know how you manage your grant money. Somebody mentioned how they manage the grant money. You don't know where it's going. Well, when you apply a person, and there's different percentages for different people. In this example, 22% of your salary goes to that from that grant. Some of these other folks, 2%, 3%, whatever it is, there's a way to track that money.
Right.
If the state is subsidizing those salaries, that should reflect in a budget. That's why we have itemized information in a budget. When I asked for the tobacco grant information, one of my first FOIAs was for all of your contracts, ma'am. What I got did not include your tobacco coordinator contract.
I
It
don't
was,
have a tobacco coordinator contract.
you told the state of Illinois you did because you were listed as the contractor for the tobacco grant as strictly
Well,
business.
I gave you my independent contractor contract.
No, ma'am, your FOIA said you did not have a contract for this program, yet you told the state you were the contractor for it. The records don't lie, and that's what's interesting with... I know you don't. The records are all right here, and if anyone would like me to lay them all out, I'll be happy to. Most of them have been published. The point is, when we ask for something, we're being lied to.
No, you're not. We answer your FOIA request to the best of our ability.
To the best of your ability. Okay.
I don't have anything to do with the budget of those grants. When I get a request for the fiscal part of that, it goes to the fiscal department.
To the board, you have grants that list people's names that have never worked on the program, and this is not an isolated incident. It's happening with multiple grants. They are getting subsidized with my tax dollars through state grants, and they never work on the program. That's fraud, plain and simple. In regards to your situation with your IT and your servers and your capabilities from your computer backups and all of these issues of we don't have that program anymore, doesn't the health department system do a daily backup? Isn't there a service you're paying for that backs up that computer system? Anybody?
Carrie, do we pay for a system that backs it up?
Yep.
You do? Wow. All you have to do is contact that entity and say you need the backup from whatever date it was backed up. I believe it's backed up at midnight every day.
How do you know?
Ma'am, I'm good at what I do.
Oh, you know.
You betcha. Because if I say it, I've got the documentation and the research to back it up. And if you don't have,
things on your website
Yeah.
that aren't true though.
prove it. If you don't have a
You have
policy,
done that. I worked at Manpower for 2 years.
that came through a FOIA.
I never worked at Manpower for 2 years.
That came through a FOIA. I have a document to back up what I said. My point is, you folks are being snowballed in so many areas and you're not asking the right questions. There's a massive amount of grant fraud where my tax dollars are being applied to a program with employees that are not working on those programs. You're being told we don't have an ethics policy is what we got lied to. Now I will say it's a lie because now we've got the records to prove it. We were refused to be given that personnel policy. A personnel policy is a demand document under the FOIA's laws. It should be provided on the spot if somebody walks into that public body. We finally, after months, find out Mr. Brumlevy asked for the same thing. The records proved that there was an ethics policy. It required a conflict of interest statement for every employee. You, ma'am, did not fill one out, but you got a $100,000+ no-bid contract, and the very procurement policy outlines no employee is supposed to get any of those awards.
I have a document that Lisa Fancher gave me, that Mr. Devine gave her, that said I was not I did not have to fill out a conflict of interest statement.
We asked for the document of the economic disclosure statement, and you said you have none.
The policy of the.
I know.
The policy says you have
The
to.
policy of the health department says anyone, that.
Every employee?
Yes, ma'am, it's
Doug
in,
told us it only had to be managed.
and this is where we're back to what this board member just talked about with the policy manual. Nobody's being held accountable to it because nobody reads it. Well, Doug said, Doug's gone, Doug said. You know what? Where's the accountability to you people with my tax dollars?
So all of these other people are supposed to have a conflict of interest statement also.
According to the policy manual that we now have our hands on, that we were told didn't exist, Mr. Brumleby said didn't exist, it does exist, we were lied to, and nobody's following it. It says annually that will be filled out. Now, I've talked to some employees that have filled out their economic disclosure. It's a requirement by the state.
I called the state and they told me I did not have to fill one out. I called my state regional tobacco program and asked it because.
Is the state your legal advisor, ma'am?
I called Lisa Fancher and she told me I did
Is
not. College? You got the policy there?
No, I thought that was what we were just going to go I thought we were going
I know, but I mean, in order to settle with that.
My suggestion to the board is very simple. Ask 2 questions when you're told something by several of these people. Ms. Hagan, you know for a fact you have a backup system. To claim that we don't have the policy or we can't find the policy or Doug changed it, no ma'am. It's there, it's on record, and how I know about it is not the point. The fact is it's there and it's available. And it's deceptive to tell this board, it's lying to your bosses that you don't have it. It's there and you know it's there. Every person that's managing a program with the tax dollars should know where those tax dollars are going. And contrary to popular belief, Mr. Jensen, we don't get paid to do this. We're not making money off of this. And there's no shortage on the truth. It's not too late for the truth to come out.
Right.
We'll try to maybe shed a little light quickly. We had a discussion. At the next meeting, we will further discuss it. We are looking at a forensic audit.
I can assure you, with what we have found, it will blow your mind.
So we are moving in that direction.
Thank you.
Need to make sure you secure the electronic data from getting destroyed. Because it will get destroyed if it hasn't already been.
Thank you for your time.
Motion to adjourn?
That she worked at Manpower, so somebody told me.